to the Antimicrobial Stewardship Program. We are fortunate here to have a ASP pharmacist, Dr. Pam Forel from Creighton University College of Pharmacy. She heads up our ASP program, and we also have another pharmacist, Jennifer Rother, who will be joining her in that practice shortly. Here also, there's physicians dedicated to this as well, so it's a multidisciplinary approach. Basically, this program, it's an interprofessional practice, education focus. There's face-to-face interactions, and then there's opportunity for education during some of the encounters as well. Now, this group will evaluate every patient that has an IV antibiotic order. They have a way to go through the system for inpatients and look at the indications, appropriateness of all IV medication orders. They will then contact the team if necessary to assist in any modifications to therapy, really paying mind to reducing broad spectrum antibiotics when appropriate or changing therapy when needed, also switching to oral therapy as indicated as well. In relation to the ASP or Antimicrobial Stewardship Program, there is, as you might imagine, some regulations and oversight with this program. And as of 2017, the Joint Commission has a requirement that patients be educated about appropriateness of antibiotics and how to essentially take those mindfully and appropriately. We have some brochures that we give to patients and provide some educational material to them whenever an antibiotic is ordered on a take-home basis. So this is a screenshot of that brochure provided to those patients. The next section is titled Handling and Administration of Hazardous Drugs. As providers, you may not find this something you encounter all that often, but essentially in the recent years, there's been more of a focus on the handling of hazardous drugs for the protection of employees. Part of that is some guidance related to PPE, when to wear it, which drugs you need to be especially careful when handling, such as anti-neoplastics. Our personnel are trained in that, and when they're preparing IV chemotherapy, for example, they go into a special area, chemo room, that has engineering setups in place for air circulation, negative pressure, and so forth. They also don the appropriate PPE when compounding those agents. More at the forefront may be that you might encounter some of the handling of agents in the inpatient setting from nursing staff and so forth. We label a lot of our tablets now because of these guidelines. For example, hazardous oral agents. We put labels on there and have to really define ahead of time how our staff are going to handle those, minimizing manipulation by staff of hazardous drugs unless they're protected or they're in a protected area like I talked about before with the chemotherapy preparation. There's also a newer way to compound IV chemotherapy. I say new as in like the last 10 to 15 years. Closed system transfer devices that allows you to manipulate drugs without them being exposed to the environment. So you don't have to use a needle, for example, in many cases to withdraw a chemotherapy agent from a vial. As part of this program related to hazardous drugs, we and many other sites, as required, go through an assessment of risk, which essentially means you have to have a specified, standardized way to review an agent and determine the appropriate way to handle that drug and also how to dispose of it and any trash that might be associated with it. And so that list is available for you under tools, resources, pharmacy resources, and then you have your hazardous drug list. We have to look at that annually as part of the requirements for USP 800.